into a church full of children is absolutely incomprehensible. Police officers from the Minneapolis Police Department immediately responded, entered the church, and attempted to provide first aid and rescue some of the children that were hiding throughout the building, while other first responders came and EMS responded to rush victims to nearby hospitals. 2 young children, ages 8 and 10, were killed where they sat in the pews. Their parents have been notified. 17 other people were injured, 14 of them being children. 2 of those children are in critical condition. The coward who fired these shots ultimately took his own life in the rear of the church. Our hearts are broken for the families who have lost their children, for these young lives that are now fighting to recover, and for our entire community that has been so deeply traumatized by this senseless attack. We will stand together to protect our children, our schools, and our houses of worship. This deliberate act of violence is just a sign of cruelty that is beyond comprehension. Our hearts are broken for everyone that's been affected by this tragedy. As we begin the difficult path of healing, I want the community to know this, that even in the face of such evil, the Minneapolis Police Department and all of our law enforcement partners stand with our community. We stand with these families and with this parish. We will continue to be here for you. With that, the investigation is obviously in its preliminary stages, and I will attempt to take some questions to provide further information.
Chief, what can you tell us about the suspect in this case? How old was he? Any kind of motivation? Any notes or any other information that left behind?
So we were looking, the question was, what can be said about the shooter? We believe it is one suspect, a sole shooter. We believe he is deceased. He is in his early 20s, does not have an extensive known criminal history, and we are looking through information left behind to try and determine some type of motive. Yeah.
How many kids at the school? How many kids at the school?
How many children? There were, I don't have an exact, the question was how many children at the school. There were dozens of children inside the mass at the time. I don't have an exact count. The children have been relocated into the school, which is where their families are reunifying with them. Reg.
Other than the weapons, was the shooter a student, former student? Was he a former employee? Do we know that?
The question was, do we know if the shooter was a former school employee or a former student? We don't have that information.
Did he leave anything behind other than the weapons?
There's a vehicle. The question was anything left behind? There's a vehicle that we believe that the suspect used that is being searched, and we will be conducting other searches related to this. Inside the parking lot here.
Yep. There was some neighbors who said that the door to the church had been barricaded.
Yep.
Is that correct?
So the question was, neighbors had said that the door to the church had been barricaded. The shooter approached on one side of the church building, and on that side, at least 2 doors, it appears there had been like a 2x4 placed. So not all of the doors around the building, but on the side where the shooter did fire.
And on the outside?
On the outside, yes. The question was there any explosives? There were reports of that. There were no explosives or improvised devices that we found. I do believe there was one, I guess you would call it a smoke bomb, like not an explosive, but a sort of a firework that would release smoke.
And which side of the building? North, south?
The side that is closest to us, here, on this side, yep. I don't have specific information on that I can release. The question was, is he dead from a gunshot wound? The answer is yes. We believe he took his own life in the parking lot.
Was this outside or both inside that he was shooting?
The question was he shooting outside and inside? He was absolutely shooting outside of the building on the side of the church, inside through the windows. It appears he may have gone inside, but I don't believe we've located any casings inside the building. So I'm not certain if he fired also while inside. It appears, if not all, most of the shooting happened outside the building.
Is this shooting related to any other shootings that happened in the last 24
So,
hours?
yeah, Taylor's asking, is this related to any of the other shootings? This does not appear to be related to any other shooting in the city.
Do you know approximately how many rounds were fired?
The question was how many rounds? I would say it's in the dozens. We don't have an exact count. There's a sidewalk on the outside as well as a grassy area. So obviously we are going through and taking our time to process the scene.
Was he firing just one weapon, like the rifle?
The question was he firing one weapon? We believe he had fired all three. He had a rifle, a shotgun, and a pistol.
Chief, was this individual licensed to conceal and carry? Did he have any?
Were the weapons, was he lawfully carrying the weapons? I don't have that information. And I don't have any information on any significant criminal history either.
Was he dressed at all in any tactical type of gear or anything?
It appeared he had some black clothing on, his cargo-type pants. I guess you could interpret that as, however you like.
All right,
Yeah.
ladies and gentlemen, thank you for helping us to get the information out today. We have a lot
No
more
more
work
questions?
that needs to be done. We will return back later today to provide more details as they become available, and we'll let you know how you can know about that in the moments to come. Thank you.
Okay,
How can the public help?
that's it. Thank you.
Minneapolis woke up to horror. A shooter attacked children at Annunciation Roman Catholic Church. 2 children dead, 14 injured, others critical. The media is calling it heartbreaking, which is true. But let's pause a second. Heartbreaking? Heartbreaking doesn't even begin to cover it. Kids sitting in pews, praying, totally innocent, and someone decides to fire a rifle, shotgun, and pistol at them. That's not heartbreaking. That's a moral collapse. Police responded immediately. But let's get real. Churches are the softest targets imaginable. They welcome anyone depressed, ostracized, troubled, and the kids. They pray quietly, trusting adults to protect them, and yet bullets come flying through windows. This is the sort of thing that makes you question not faith, but our systems, our safety systems, our city leaders. Trey Gowdy, former prosecutor, said it straight. Churches are the softest targets and children the most innocent victims. He's not wrong, but what are we doing to protect them? Sitting around, holding press conferences, offering thoughts and prayers, and saying, well, maybe next time we'll think about safety protocols. How many times have we had to have this conversation about soft targets, about schools, about churches? Far too many. The shooter, a man in his early 20s, is dead. That's at least one problem solved. But what about the rest? The kids who survived? The ones who will carry this memory forever? The parents? The community? There is no easy fix, no magic bullet, literally or figuratively. And yes, we should mourn, but we also need to wake up to the reality. Soft targets are soft because we let them be. We give criminals space to exploit. Meanwhile, the media is busy spinning narratives, debating whether safety is practical or whether gun laws could have prevented this. Of course, none of that brings the children back. None of it addresses the immediate need to protect kids in places designed for sanctuary, places meant to offer peace, not terror. Every newscast, every press briefing repeats the same talking points: heartbreak, tragedy, investigation. Meanwhile, the story never gets to the question of responsibility, prevention, or accountability. Imagine being a child sitting in church at 8:30 a.m., the first week of school, expecting normalcy, a routine of prayer and learning, and then suddenly hearing the staccato burst of bullets ripping through windows. You can't prepare for that. You can't train for that as a child. And adults supposed to be protectors can only scramble to respond after the fact. That's not just tragic, that's a failure of imagination. The numbers are horrifying. 2 dead, 17 injured, 14 of them children. The law enforcement response was immediate. But immediate is not preventative. Immediate is reactionary. The shooter carried multiple firearms and a smoke bomb, suggesting planning, intent, and a total disregard for human life. And while the shooter is gone, the consequences ripple outward. Survivors will carry trauma, parents will carry grief, teachers, clergy, and first responders will carry guilt, second-guessing. We should also notice the pattern. Schools and churches have been recurring targets. There is a culture of expecting safety in soft targets while doing nothing to reinforce it. Yes, churches exist to welcome the troubled and the ostracized. That is their purpose. But when welcome is met with bullets, the calculus has to change. Safety measures, security protocols, awareness, these aren't optional anymore. And yes, for parents, the only solace might be faith, that these children are with someone who loved them most. But for society, faith is not enough. Faith won't build bulletproof glass. Faith won't station trained officers at every vulnerable point. Faith doesn't replace responsibility. Let's not kid ourselves. The shooter's death is a relief. He won't hurt anyone else. But every moment after, the conversation shifts to words instead of action. And the truth is harsh. Without proactive measures, soft targets will remain soft and tragedies will repeat. We mourn, we analyze, we pray. But unless we take concrete steps to protect our most vulnerable, nothing changes. The children in Minneapolis were praying, innocent and gone. The lesson is clear. And the question is unavoidable. When will we stop treating soft targets as optional and start treating them as a priority? The answer isn't simple, but ignoring it ensures history will repeat itself. Churches, schools, playgrounds, places meant for peace must become places of protection, too. Otherwise, the next headline, the next heartbreaking press conference will feature the same story with different names, but the same preventable suffering.
Something about he went around to one side of the church and it was barricaded potentially with a 2x4. We're going to have to get more details on that, but it sounds like at some point, maybe in between the firing, he went up to that church and there were people inside who tried to stop him from getting inside. But just think about it, guys. All these young children, we're talking elementary age school kids, sitting in church. It's quiet in there. They're praying. They have no idea what's outside. They're not looking out the windows, most likely. And then all of a sudden, from what we've heard with the witnesses, it was just boom, 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 dozens of gunshots, rifle rounds coming through the windows. And again, the horrible news that children have died as a result of this, 8 and 10 years old. We'll send it back to you.
Incident.
For a moment as now we are listening to the hospital press conference live.
This morning, that gave us time to mobilize all of our resources and prepare our teams. We are a level 1 trauma center and we prepare and we train for this. Having said that these incidents are never easy. We've had 2 in the last 24 hours that have occurred, these mass casualty incidents. The one today, we received a total of 11 patients from this incident. 2 of them were adult patients, 9 pediatric patients. 4 of them required the operating room. And up to this point in time, there have been no fatalities related to any of those patients that were brought to our organization. I want to take a moment to tell you how proud I am to work for this organization and the teams that were involved, the resources, again, that were mobilized, our surgical colleagues, our medicine colleagues, our amazing nursing staff, our psychologists that help process these events for us, environmental services, all those involved. Hennepin EMS brought in all the critical patients from that scene to our organization, and we were very lucky to have 2 emergency medicine, emergency medical services directors that were on scene and able to provide us with really important information that, again, helped us to prepare for this event. So I don't have any individual or specific information about the patients at this time for you, so that's all I can share. Thank you for being here. Any questions?
You said they were in critical condition?
7 were brought in as critical patients, and at this time, I don't know the updates on what the conditions are of many of them. 4 of them required the operating room, as I said.
That there was a baby?
There were, again, 9 of the 11 patients were pediatric ages. I can't remember the exact name, the exact ages. I believe it's 6 all the way up to 14. That's the range.
Can you tell us a little bit about what types of teams you had working this morning, how many people it takes to treat a thing like that?
Yeah, you know, whenever that type of a page goes out, again, it really puts into motion a lot of a big response from all of the teams. And so we are, because we're a level 1 trauma center, we have to, you know, mobilize certain types of resources like, you know, operating rooms and the surgical services. We have to have emergency providers and nurses. We have to, you know, mobilize things like the laboratory and the blood bank. So there's a lot of planning, and again, a lot of exercises we do throughout the year to prepare for these events. And unfortunately, you know, we respond to many of them throughout the year.
Can you talk about the injuries at all, or any type of what you're seeing here with some of these patients?
You know, I can't get into specifics, but we are dealing with gunshot wound injuries from apparently a high-velocity weapon. And, you know, gunshot wounds can be very problematic because they can involve multiple body systems. And again, they require a lot of resources to manage. But again, you know, we see a lot of gunshot wounds here at Hennepin Healthcare, and we're among the best in the nation every year at managing penetrating trauma. So we are used to seeing them.
Does anyone tell us where the status of the 11? Are any of them still in surgery?
I don't know the status of it. I can't share that with you at this time.
Was anyone shot more than one?
I can't share that information with you at this time.
Can you confirm the families of some of the victims that made their way here?
Yeah, we've had quite a bit of effort to stand up a reunification center across the street here in our clinical specialty care building. And so to my knowledge, I believe all or almost all of the families and loved ones have been reunited with patients and know their status.
Do you know if anyone is being treated at any other locations?
My understanding was we had a lot of the non-critical patients that went to Children's Hospital, and I believe one went to Masonic Children's Hospital as well. I don't know the status of any of those patients.
Can you speak to the toll it takes on physicians here who have to handle these types of cases and mass handle the case within hours?
Yeah, it does take a toll. Thank you for asking that. Asking that question. I think. Again, we have psychologists that we have dedicated to our emergency department to help with our providers and our nurses and other workers that manage these types of events. Again, you know, we've had 2 mass casualty events happen in the last 24 hours. I mean, that does take a toll. But we also have to recognize that we are here as a critical resource for our community, and we have to take time to process, you know, these the care that we deliver.
Minneapolis was rocked today by a horrific shooting at Annunciation Roman Catholic Church. Dr. Thomas Wyatt, chair of the emergency department at Hennepin Healthcare, gave an update from this level 1 trauma center. 11 victims, 2 adults and 9 children aged 6 to 14 were rushed in, with 4 children requiring immediate surgery. Dr. Wyatt emphasized that despite extensive training, treating gunshot trauma is never easy. Emergency staff not only work to save lives, but also face significant psychological strain. The hospital has dedicated psychologists on hand to support staff coping with this tragic incident. Reporter Bill Malugin confirmed that all 11 patients are currently alive, providing a small measure of relief amidst the tragedy. Sadly, 2 children, aged 8 and 10, did not survive. Authorities have not yet identified the shooter, and investigations into the motive and circumstances are ongoing. This heartbreaking event highlights the vulnerability of soft targets like schools and churches, where the most innocent are often at risk. It also underscores the critical importance of emergency preparedness and the support of first responders and medical teams in moments of crisis. If you found this video informative, hit that like button, subscribe, and ring the notification bell to stay updated on breaking news. Drop a comment below with your thoughts on how communities can better protect children and safe spaces.